Hi everyone, my name is Jamie Curtis and I'll be the moderator for this debate tonight. Additionally, I'll be acting as the fielder at the end of the debate and answering several questions from our audience. Today we'll be discussing the differences and similarities between applied behavior analysis and positive-based school-wide intervention. Our pro side will be discussing the close connection between ABA and SW PBWS, while the con side will present their beliefs on how the two are different. Our debate will be following an informal format. So let's do some introductions really fast. This is Julie Silva. She will be our stater for the pro side. This is Sarah Van Pelt, and she will be our attacker for the pro side. Then on the con side, we have Mariela Escobar, and she'll be the con side stater. And then we also have Ashley Gerardo, who will be the attacker for the con side. So with that, we'll go ahead and turn the time over to Julie, who will give us a brief introduction into SWPBS.
Hi everyone, my name is Julie Silva and I will be the stater for the pro side. I will introduce school-wide positive behavior support, also known as SWPBS. You will hear me say PBS for short during our presentation. Looking into history, PBS emerged from the controversy surrounding the use of aversive consequences with people with developmental disabilities. Authors have cited in various articles that indicate that this type of broad-based movement was emerged in support of non-aversive behavior management during the 1980s. By 1987 to 1992, the U.S. Department of Education National Institute on Disability and Rehabilitation Research helped with the development of PBS. They granted $670,000 for a rehabilitation research training center on community reference technologies for non-aversive behavior management. This was really a turning point for individuals with developmental disabilities. So what exactly is PBS? Starting from 1990, Horner et al. Stated that it encompassed many distinctive elements such as emphasis on lifestyle change, functional analysis, multi-component interventions, manipulation of ecological and setting events, antecedent manipulation, teaching adaptive behavior, building environments with effective consequences, minimizing the use of punishers, distinguishing emergency procedures from a proactive programming, and social validation with a special role for preserving the dignity of the recipients of intervention. All of these factors shed light on what PBS was in the early stages of PBS. More recently, in 2000, Horner further typified PBS as an approach that blends values about the rights of people with disabilities with the practical science about how learning and behavior changes occur. In alignment with Horner's ideas, in 2002, Carr et al. Described PBS as an applied science that uses educational methods to expand an individual's behavior repertoire, and systems change methods to redesign an individual's living environment, to first enhance the individual's quality of life, and second, to maximize his or her problem behavior. Lastly, in 2003, Warren et al. Also stated that PBS is intended to enhance quality of life and minimize or prevent problem behavior through the rational integration of valued outcomes, behavioral and biomedical science, empirically supported procedures, and system change. Positive behavior support in a school is implemented at 3 levels: universal support, targeted support, and individual support. PBS is a comprehensive system of support that is in place in all areas in a school, for example, hallways, classrooms, cafeteria, or the schoolyard. The goals of PBS are to prevent the development of a problem behavior, to decrease or eliminate currently occurring discipline problems, and to increase positive social behavior for all students. Although some recent statements suggest that PBS focuses mainly on disciplinary problems in schools, Some researchers argue that PBS can be extended to serious problem behaviors like self-injury, aggression, property destruction, pica, defiance, and disruption. This difference in emphasis between PBS and ABA may lie in the desire of PBS leaders to provide an intervention model that appears to be relatively non-technical in nature. Because PBS is marketed largely to service providers who typically lack formal training in ABA, it may be important to avoid presenting a complex body of procedures as the core of its approach to services. ABA, on the other hand, has a multi-tiered approach to intervention, in which formally trained and certified professionals are, in principle, available to provide guidance, assistance, and monitoring to those who lack such expertise. Despite the apparent need for comprehensive skills on the part of PBS practitioners, the PBS service model is based on providing training directly to the end users. This is individuals who provide direct services to consumers and those who supervise those individuals. There's no general mechanism for academic training of professionals, as in the ABA model. Now I'll return your attention to Sarah, who will be, I will turn your attention to Mariella, who will be the stater for the con side.
Hello, my name is Mariela Escobar. I will be introducing applied behavioral analysis and cone side. ABA is the science in which tactics derived from the principles of behavior are applied systematically to improve social significant behaviors to a meaningful degree, to demonstrate experimental that the procedures employed were responsible for the improvement in behavior. The process of ABA is systematic. The individuals are analyzed to assess the problem behaviors. Behavior is identified and intervention methods are implemented to modify the behavior. In the process of intervention, the behavior instructor provides reinforcement to prompt and maintain the desired behavior. Applied behavioral analysis has been used as a method of behavioral therapy since the 1960s to benefit individuals with developmental disabilities, such as children with autism. ABA and research. ABA principles reflect the current research. ABA is a disciplinary field of behavior analysis. ABA analysis is not only a form of behavioral therapy. Applied behavioral analysis involves an integration of research and application, including an intensive body of research. Research studies must be applied, behavioral, analytic, and in addition, it should also be technological, conceptual, systematic, and effective. As stated in the BACB Code 101, behavioral analysts rely on professional knowledge based on science and behavioral analysts when making scientific or professional judgments. Behavioral analysts have argued that PBS is harmful to ABA. One premise of this argument is that PBS is unscientific because PBS interventions have been evaluated with non-rigorous design, such as anecdotal observations. An emphasis on skill building and quality of life, with a secondary priority of reducing problem behaviors. Fidelity. SWPBS implementation is increasing. However, there's still little is known about the fidelity in which teachers implement WPBS practice in the classroom. There is also a lack of evidence of the perceiving challenges school personnel face when implementing PBS in schools. ABA, on the other hand, can be implemented in different settings. It can be implemented in in-home, natural settings such as community, school, and clinic settings. Now Jamie is going to show us a picture. In that picture, we can see the two different settings, a home setting and a school setting. Now we're going to move to ABA professionals in training. Professionals in the field of applied behavioral analysis undergo to intensive training and preparation. ABA has a multi-tier approach to intervention in which professionals are normally trained and certified. That behavior analysts have education at the master level and bears the responsibility of creating appropriate treatment plans. That behavior analyst certification is considered the standard center. The BACB mandates that certified behavior analysts hold a master's degree. Behavior analysts are required to have 270 hours of core curriculum and 1,500 hours work experience. Behavior analysts are required to pass the National Certification Exam to qualify for the Board Certified Behavior Analyst (BCBA) credential. Behavior analysts provide guidance, assistance, and monitoring to those who lack expertise, such as direct staff, parents, caregivers, and teachers. Professionals in the field of ABA has high standards and encouragement of ethical and professional principles for teaching new skills and addressing specific problem behaviors. Any model following ABA principles or practitioners who follow ABA principles should follow ABA professional standards and incorporate decades of research in behavioral analysis. Now we're going to discuss the 7 dimensions. The 7 dimensions of applied behavior analysis were introduced by Barrow, Wolf, and Risley in their article, Some Current Dimension of Applied Behavior Analysis in 1968. The 7 dimensions describe the fundamental characteristics of a good intervention. Treatments that do not follow all 7 dimensions are incomplete and potentially compromise its effectiveness. The 7 dimensions. Any treatment plans should follow the 7 dimensions. The first dimension is apply. Apply interventions deal with problems of demonstrate social importance. The second dimension, behavioral. Apply intervention deal with measurable behavior or reports if they can be validated. The third dimension is analytic. Apply intervention requires an objective demonstrate that the procedures causes the effect. An intervention should also be technological. Apply interventions are described well enough that they can be implemented by anyone with training and resources. Conceptual system. Apply intervention arise from a specific, identifiable theological base rather than being a set of package of tricks. Number six, effective. Apply intervention produces strong, socially important effects. Number 7, generality. Apply interventions are designated from the outset of operate in a new environment and continue after the former treatments have ended. Now we're going to transition to the pro side with Sarah.
Unmute. Okay. Hi there, my name is Sarah Van Pelt, and I am on the pro side. While we're on the topic of the 7 dimensions of ABA, I'd like to bring up the article that was written by Anderson and Kincaid, which discusses how SWPBS put significant effort into following the 7 dimensions of ABA, which was developed by Bayer, Wolf, and Risley. I'm going to go over how SWPBS does this in order to set a foundation for our debate. Applied. SWPBS follows the dimension of being applied by assisting in the reduction of problematic behavior and supporting the increase of positive social behavior of students. It is also applied at different levels, ranging from school, district, and even state level. For the behavior dimension, behavior targets are observable, and SWPBS demonstrates that the targeted behavior itself is being changed by using discipline referrals, which provide a written record of behaviors. Analytic. SWPBS demonstrates the dimension of analysis by observing behavior that is measurable and creating generalized intervention plans that demonstrate how to make specific changes to entire school systems. The conceptual link between the philosophy of behavior analysis is that SWPBS emphasizes data-based assessment and decision-making. Interventions are ideographically implemented, and intervention components are derived directly from research in the field of behavior analysis. As with ABA, it is necessary to show that it's the intervention that is creating the change. Most studies that support SWPBS use an A-B design to evaluate its effects. Technological. In the case of SWPBS, technological precision relates to the extent to which implementers strive for precision in individual schools. Implementation procedures are broken down into a written, visual format that encourages a clear understanding. Effective. SWPBS is an application of a theory and practice of behavior analysis to a system-level analysis and change. It is applied in a way such that it will be durable and maintained over time. Empirical demonstrations of the efficacy of SWPBS are growing. Generality. SWPBS focuses on increasing the quality of life of students and on increasing wanted socially significant behavior across many settings. Therefore, SWPBS does meet the requirements of generality.
All right, thank you so much, Sarah and Julie. We'd now like to transition over to Ashley, who will begin presenting the con-side arguments.
PBIS is a loosely scientific procedure. In contrast, ABA is the scientific approach to behavior change. In an article by Johnston, Fox, Jacobson, Green, and Molick, they quoted Horner et al. Saying there's no scientific specific technique or procedure that distinguishes the approach of SWPBIS. Different proponents offer varying procedural recommendations and different theories of behavior in its support. In saying this, there is no specific technique or procedure that distinguishes the approach of SWPBIS.
In a 2002 article written by Sugai and Horner, they state that because the roots of PBS are in applied experimental analysis of behavior, the evidence for PBS at this time is primarily derived from single subject designs. This research, while not in the traditional empirical mode, is nevertheless rigorous, generalizable, and strong in social validity. Later, in 2007, in an article by Cohen, Kincaid, and Childs, they agree with this statement made by Horner saying that preliminary outcomes, office discipline referrals and suspensions, indicate the effectiveness of SWPBS in decreasing school-wide behavior problems and creating positive school climate. Although the results of a majority of the program evaluations yielded significant findings, there has been a lack of measurement of treatment fidelity, possibly due to the absence of expedient, effective assessment tools. So, therefore, the purpose of their study was to discuss the school-wide benchmarks of quality. This is a tool intended to measure the implementation of SWPBS. Descriptive data on the instrument, including internal consistency, test-retest reliability, inter-rater reliability, and concurrent validity were collected and analyzed. Results indicate that the BOQ, the school-wide benchmarks of quality, for SWPBS is a reliable, valid, efficient, and useful instrument for measuring the fidelity and implementation of the primary or universal level of PBS application in individual schools. So, although it is agreed that SWPBS is lacking in scientific validity, this tool demonstrates that there are ways to rectify this issue.
So although we agree that there is some scientific validity lacking, I'd like to point out that PBIS is a blanket intervention and is not individualized at the Tier 1 or Tier 2 levels. This directly contradicts many of the ethical compliance codes for behavior analysts. I'd like to point out the Code of Ethics, Section 3, Behavior Analytic Assessment. According to the Behavior Analyst Certification Board Code of Ethics, it is our responsibility to provide assessment in order to provide appropriate interventions. SWPBIS is often based on a needs assessment or other indirect assessment to establish need, such as the discipline referrals that were mentioned earlier.
I'd like to draw everyone's attention to the Center for PBIS graphic that helps explain how data is used for decision making. So, although here is often no direct or standardized assessment in SWPBS, there is data that is collected and analyzed on an ongoing basis in schools using SWPBS effectively and with fidelity. According to the Center of PBIS, data is an integral part of informed decision-making in SWPBS. The use of data to support continuing and intervention, the use of data to support continuing an intervention or to discontinue is something that is consistent between ABA and SWPBS.
When we continue looking at the Behavior Analyst Certification Board Code of Ethics, I'd like to call on Section 4, Section 4.02, involving clients in the planning and consent. According to the Behavior Analyst Certification Board Code of Ethics, it is the right of our clients to be involved in the planning of their treatment and consent to the behavior change program. A child in the school setting will simply be placed into the school-wide or Tier 1 systems and are not given real choice in the matter. I'd like to draw everyone's attention to the 3-tier system that many response to intervention and school-wide positive behavior support systems are based off of. At Tier 1 and Tier 2 is where about 90 to 95% of students will fall. This is what we call the universal tier, Tier 1, and targeted tier, Tier 2. In these two tiers, there is not much individualization for students. In order for students to reach a level where there is individualization, they are typically exhibiting severe behaviors or are receiving special education services. Tier 3 is your remaining 5 to 10% of students in your school. This is a contradiction to our Code of Ethics, as our Code of Ethics states that we will individualize the behavior change programs for our clients. When we look at the conceptual system of PBIS, many of the applied interventions ABA is an applied intervention that arises from a specific and identifiable theoretical base rather than being a package set. However, many PBIS systems are sold as a package. Principles 100 Club is an example of this. It is a packaged intervention that is taught to teachers in a professional development training, while those that are providing behavior analytics services, on the other hand, have studied the science and are being supervised by a board-certified individual. The Center for PBIS states on its website that they do not support commercial products related to SWPBIS. However, that does not stop the retail of these programs.
Well, in the Horner, Sugai, and Lewis article, they state that PBIS is not a packaged curriculum, but an approach that defines core elements that can be achieved through a variety of strategies. The core elements at each of the 3 tiers in the prevention model are defined in this table. Obviously, SWPBS isn't individualized like applied behavior analysis is. This is why it's called school-wide positive behavior support. However, in an attempt to create a more productive and happy classroom environment, SWPBS establishes these elements as targets, goals brought to the classroom, which are derived from the science of ABA and have been shown effective. That can appear to be a packaged curriculum, but there are many ways to implement these elements, and this happens on a case-by-case, individualized basis.
I'm sorry. Okay, here we go. Okay, so we're going to go ahead and answer a few questions at this time. So question number 1, are PBIS and individual intervention plans for students behavior mutually exclusive, and do they need to be? So we actually felt like the intervention plans in some ways do need to be exclusive, but at the same time, they don't have to be. So we recognize that each individual is unique, and some individuals do need extensive and detailed procedures to deal with their behaviors. On the other hand, we also recognize that some elements of these behavior programs, particularly well-written behavior programs, can be incorporated into the school-wide system. Okay, so our second question, our second question, if you had to give a short elevator speech explaining how ABA and PBIS are connected to a school administrator that you're trying to convince on the merits of ABA and PBIS for their school site, what would it sound like? So both ABA and PBIS, as we have heard earlier are connected in a variety of ways. So first of all, they both follow all the seven dimensions of ABA. At least that's the pro side view of things. While the con side may say that they're a little bit more disconnected. However, we can recognize that both ABA and PBIS both use positive interventions over ineffective punishments like yelling or sending students to the principal's office. All right, so that pretty much concludes our debate for tonight. We'd like to thank you all so much for watching, and we'll just show our references. And all right, there we go. Thank you so much, everyone, and have a wonderful night.